Hello everyone, I am Dr. Suraj Muralidhar. Coming to the genetics, if at all in a family a person is at higher risk of forming the kidney stones, in his family even the other members are also having a higher risk of forming the kidney stones. Sometimes we see multiple stones in small children who are having metabolic disorders. Consumption of excessive salt also increases the risk of forming kidney stones. Consumption of high quantity of proteins also risk the formation of kidney stones. I can give you an example of one of my patients who was a professional bodybuilder. He used to take a lot of proteins every day, and the amount of water which he used to consume was much lesser to the proportion of protein intake. And he came to me with multiple stones in both the kidneys. So we have to be very cautious whenever a person is taking high amount of proteins. Patients who are having recurrent urinary infections are also at higher risk of forming kidney stones. And patients who are obese, having diabetes, hypertension and other chronic disorders, they are also at a very high risk of forming kidney stones. So what are the symptoms in a patient who is having a kidney stone? A patient can present with severe flank pain or lower backache which is radiating to the groin. Sometimes this is referred to as colicky pain. It is moderate to severe in intensity. Patient can also have burning sensation while passing urine. Patient can present with blood in urine. Sometimes even nausea and vomiting can be associated. So whenever a patient who comes with these symptoms, we need to diagnose as early as possible and give a prompt treatment. So first and foremost, the diagnosis is done by the clinical symptoms and by a simple ultrasound scan, which can recognize the kidney and the ureteric stones. However, sometimes the ultrasound will not be able to pick up certain smaller stones or certain stones which are obscured by the bowel gas or other body organs. In those cases, we need to confirm it with the help of a CT scan. So in a CT scan, we will get to know the exact location, the correct dimensions, and also the density of the stone and plan our treatment accordingly. So now coming to the treatment part. So first of all, the treatment depends upon various factors like the number of stones, the size of the stone, the location of the stone, and also the density of the stone. And accordingly, it can be managed by medications as well as minimally invasive surgery or even certain other major surgeries as well. So first of all, very small stones, we can say less than 4 or 5 millimeters in size, we can always initially treat them with certain medications to control the pain and adequate fluid intake, so that these small stones usually tend to pass out spontaneously. Certain medium stones of the size of around 5 to 10 millimeters in size. So here we can use many minimally invasive methods to treat the ureteric stone or the kidney stone. So if at all, if it is in the ureter, we can do a procedure called as URSL, and then using a pneumatic method or a laser method, which is the most recent advanced method to treat the ureteric stones, we can powder the stone into fine dust and then put the patient on a stent, which helps in passing out the fragments of the stone. Even if the stone is present in a remote location inside the kidney, one of the smallest branches, still we can do a flexible renoscopy, go near the stone, and with the help of a laser, we can powder the stone and then clear them. Sometimes in very large stones, so for example, in case of a staghorn stone, we cannot do these methods and we'll have to do a procedure called as a PCNL. So wherein we make a small hole at the back and then make a small hole in the kidney and remove the stones fragment by fragment. Certain other methods like pylolithotomy or ureterolithotomy are also done nowadays, but however rarely, which can be done in an open or a laparoscopic method. So how can you prevent kidney stone formation? First and foremost, stay adequately hydrated. That is, drink at least about 2.5 to 3 liters of water every day, and then avoid certain foodstuffs which are actually more prone in causing stones like spinach, nuts, chocolate, red meat. Avoid excessive intake of salt, excessive intake of proteins. Lead a healthy lifestyle. Exercise regularly and maintain proper weight. And if you follow all these, the formation of stone, the chances are very less.